Dear students, today we are going to discuss about human reproductive health. Welcome to our channel Read MedPrep Academy. In Human Reproductive Health Part 1, we are going to talk about need for reproductive health, amniocentesis and its ban, social impact of sex ratio, female feticide and infanticide. Now, let us first introduce you to human reproductive health. Reproductive health represents a society with people having physically and functionally normal reproductive organs. Healthy people have healthier babies and are able to care for their family and contribute more to the society, community and the country. Hence, health is a community, national and international issue. Reproductive system is a complex system controlled by the neuroendocrine system, which we have seen already in the human reproduction lectures. Hence, it is important to take necessary steps to protect it from infectious disease and injury. My reproductive health is my responsibility. Reproductive health, what problems we are facing and what are the strategies to be adopted. India is among the first few countries in the world to initiate family planning program since 1952 and is periodically assessed every decade. Now, family planning is a very important aspect. Family planning is essential to end hunger and poverty, to increase the education of the people, to empower women, to improve infant health, to improve maternal health, to decrease sexually transmitted diseases like HIV and AIDS, to save the environment and to support partnerships among the people. Something about the historical background about these family planning programs. In 1952, the National Family Planning Program was started. In 1977, the National Family Welfare Program was adopted. In 1985, Universal Immunization Program was instituted to help children to prevent diseases. And in 1992, Child Survival and Save Motherhood Program was instituted. In 1997 onwards, the Reproductive and Child Health Phase 1 was started. These programs are popularly named as the Reproductive and Child Health Care Programs, which was introduced by the Government of India. The first phase of RCH was introduced in 15 October 1997 and the RCH phase 2 was introduced on 1st April 2005. What are the major tasks of reproductive and child health programs carried out under these programs are creating awareness regarding the reproductive and child health and providing medical assistance to build a healthy society. You can see how a health worker is giving awareness about the reproductive health to women and introducing sex education in schools to provide information about adolescence and adolescence related changes, educating couples and those in the marriageable age groups about the available birth control methods and family planning norms. The birth control methods like usage of condoms, spermicides, diaphragm, female condoms, about pills, implants, injections, intrauterine devices, mucus methods, and information is also given about the breastfeeding after the delivery. Creating awareness about the care of the pregnant women, postnatal care of the mother and the child, and the importance of breastfeeding are all very important. Why breastfeeding is important for the babies? Natural antibiotics that are present in the breast milk protect the babies. From what? From various diseases like gastritis, like pneumonia, diabetes, diarrhea, obesity related illness. And the long term breastfeeding increases the IQ among the children. Why breastfeeding is important for the mothers? It protects the mothers from breast cancer, uterine cancer, diabetes and postpartum depression. So, lot of encouraging and support is given to the government and the non-government agencies for the RCH programs, and new identified methods are implemented to improve the existing methods of birth control, like for example the usage of condoms, the intrauterine devices, the spermicides, the natural methods of rhythm, calendar method of rhythm, oral contraception, contraceptive patch, hormonal ring, contraceptive injection, surgical sterilization methods like tubectomy and vasectomy. Globally, about 800 women die every day of preventable causes related to pregnancy and childbirth. 20% of these women are from India. Although India has witnessed a dramatic growth over the last 2 decades, maternal mortality still remains high as in comparison to many developing countries. What is this maternal mortality? The maternal mortality is the number of maternal deaths in a given period per population of women who are of the reproductive age group. What is the maternal mortality ratio? The maternal mortality ratio can be calculated by dividing the recorded or estimated maternal deaths by total recorded or estimated live births in the same period and multiplying this by 1 lakh. So MMR is equal to maternal deaths divided by live births into 1 lakh. MMR was 550 per 1 lakh in 1990. This because of the various programs by the government and the non-governmental organizations, it fell to 130 per 1 lakh in 2016. That's a fall of 77%. What is infant mortality rate or IMR? The ratio of the infant deaths registered in a given year to the total number of live births registered in the same year, usually expressed as rate per 1000 live births. So IMR is equal to number of deaths of the children less than 1 year divided by number of live births multiplied by 1000. India's infant mortality rate was 44 per 1000 live births. Now it has declined to 33 in 2017. In 2018, it is 32 per 1000 live births. Further, it has declined in 2019 and 2020. So to sum up, what are the components of RCH? It's family planning, it's child survival and safe motherhood, prevention and management of reproductive tract infections, STDs, AIDS, adolescent health care and family life education. So the approach is towards the patient. The healthcare programs of the government of India were organized like massive child immunization, supply of nutritional food to the pregnant women, Janani Suraksha Yojana, Janani Shishu Suraksha Karyakaram, RMNCH plus A approach was instituted. What is this RMNCH plus A approach? It is reproductive, maternal, newborn or neonatal, child and adolescent health. In this approach, there are 5 pillars. We are giving importance to the reproductive health of the mother and the father, the maternal health while the lady is pregnant, the neonatal health while the child is born, then the developing child and the care of the adolescent. Pradhan Mantri Surakshit Matritva Abhiyan. What is this? What is the aim of PMSMA program? It is to provide assured, comprehensive and qualitative antenatal care free of cost universally to all pregnant women on the 9th of every month. This was instituted to take care of the pregnant women in the country, and many more such programs at the national level was instituted by the government of India. Now let us discuss about amniocentesis and its statutory ban. What is amniocentesis? First of all, due to small family norms and skewed choice of a female child, the female population is decreasing at an alarming rate. So amniocentesis was done. What is it? It's a prenatal technique used to detect any chromosomal abnormalities in the fetus, and this technique was misused. How? It was used to determine the sex of the fetus. When the sex of the fetus was determined, the chance of female feticide was high. It was rampant. Hence, a statutory ban was imposed on amniocentesis. So what is the social impact of this on the sex ratio? The sex ratio is the ratio of the males to the females in the population. In India, the child sex ratio has decreased over the decade from 927 to 919 females for every 1000 males. You can see in this chart that in 1981 it was 962. It slowly declined to 919 in 2011. That means the ratio between the boys being 1000 and the girls being 919. To correct this ratio, steps are needed to change the mindset of the people, to change the attitudes of the people, especially in the young adults who are newly married. And there is an imbalance in the sex ratio also in India. This imbalance is because of the gender discrimination in our society. Now, let us discuss about female feticide and infanticide. What is female feticide and infanticide? It's a manifestation of gender discrimination in our society. Female feticide refers to aborting the female child in the mother's womb. What is female infanticide? It is killing the female child after her birth. These have resulted in an imbalance in the sex ratio. In UNDP's GII 2018, what is this UNDP's GII? United Nations Developmental Programs on Gender Inequality Index. This reflected that India was ranked at 135 out of 187 countries due to availability of very few economic opportunities to women compared to men. Now, how this gender inequality index was approached? First, we must know that there are 5 indicators. The maternal mortality and the adolescent fertility, which contributes to the reproductive health. This helps calculating the gender inequality index. Next is the parliamentary representation and the education of the women. This gives empowerment. This contributes to the gender inequality index. And the third is the labor force participation, which contributes to the labor market, going on to the gender inequality index. In order to prevent female feticide and infanticide, the government of India has taken various steps like PCP-NDT Act. What is this PCP-NDT Act? The expansion of PCP-NDT is preconception and prenatal diagnostic techniques for selective abortion. In this act, what it defines? It's an act to provide for the prohibition of sex selection before or after conception and for regulation of prenatal diagnostic techniques for the purposes of detecting abnormalities or metabolic disorders or chromosomal abnormalities or certain congenital malformations or sex-linked disorders and for the prevention of their misuse for sex determination leading to female feticide. Various measures were also taken by the government to ensure the survival of the girls, to provide better nutrition to the girl child, to provide better education of the girl child, the protection of the girls, empowerment of the girls by eliminating the differences in the sex ratio, decrease the infant mortality rate, and improving their nutritional and the educational status. Now, what is this POCSO Act that was instituted in 2012? POCSO means Prevention of Children, POC, for Sexual Offences, SO. POCSO Act. Sexual Harassment at Workplace Act. This is Prevention, Prohibition and Redressal Act. And these changes were brought in India in the criminal law based on the recommendation of Justice Verma Committee in 2013. This aims at creating a safe and secure environment for both the males and the females in the workplace. So, we have to concentrate on saving the children from dangerous people. We now have discussed about the need for reproductive health, sex education in schools, family planning and health awareness, amniocentesis and why it was banned, social impact of sex ratio, female feticide and infanticide, and child protection. Thank you. Kindly subscribe, like, share and comment our channel Read MedPrep Academy. Log on to www.readmedprepacademy.com. Our Facebook ID is Read MedPrep Academy. Our email is readmedprepacademy@gmail.com. Thank you very much.